All right. Hi, everyone, and welcome. I want to begin by thanking you for joining us today for this presentation on aging and intimacy for older adults and family caregivers. I am Tatiana Mariscal with Family Caregiver Alliance, and I would like to share some information about Family Caregiver Alliance. For over um, for over 4 decades, we've provided direct service and support for family caregivers of adults with physical and cognitive impairments. Family Caregiver Alliance also advocates for caregivers in the area of policy, research, and public awareness on a local and national level. For more information, please visit caregiver.org or follow us on our social media platforms. For today's presentations, as I mentioned, your phone and mics are going to be muted, but we invite you to become a part of this conversation. So ask questions, share comments at any time during this presentation. You can do this by using the chat function located at the bottom of your Zoom screen. I'll give everyone a few seconds to locate your chat function. You can also use other forms of communication, such as raise your hand function, to request to be unmuted or ask questions during the Q&A part. You can also use other nonverbal feedbacks to answer questions or ask for the presenter to slow down. To locate these tools, please click on the participant icon at the bottom of your screen. I would like to give a warm welcome to my colleague, Rachel Creed, Intake Coordinator and Local Resource Specialist at Family Caregiver Alliance. She recently facilitated a class focused on managing stress and building tools for self-care. She has a deep interest in women's health issues, health education, and bridging cultures. Rachel received a BA in Women's and Gender Studies from San Francisco State University and will have achieved a sexual health educator certificate by the end of this month. And with that said, I'll turn it over to Rachel.
Welcome to Aging and Intimacy for Older Adults and Family Caregivers. Caregiving changes roles, shifts expectations, and brings new responsibilities. Many caregivers find that these changes transform their closest relationships in ways that leave them feeling frustrated and unhappy. This class explores various avenues for intimacy for older adults and family caregivers. The ways that aging, intimacy, and sex interconnect with one another will be broadly examined. Physical as well as social factors that affect intimacy will be broadly talked about, as well as sexual health for older adults. So overall, the goal of this presentation is to normalize conversations around intimacy for older adults, family caregivers, as well as to challenge existing stigma and better understand some of the issues for older adults and caregivers that affect intimacy. Through this, we might better address those needs while centering safety and healthy relationships. And then just to share a quick disclaimer, the information shared today is meant to provide general education around intimacy that many older adults face, especially considering how little this topic is addressed. I do want to say I'm not a medical professional, so I do want to encourage everyone to consult with a trusted doctor or a social worker that is more knowledgeable about certain medical conditions or dementia caregiving, and especially speak to a doctor about medications or medical conditions. So what is aging? Aging is oops, Tatiana, can you hear me? Okay, great, thank you. Aging is a highly individualized and complex process. In other words, aging occurs naturally over time and looks differently per individual. Multiple factors are involved that contribute to potential changes. Those changes can be physical, emotional, or cognitive. Despite aging being a natural process that happens to everyone, it continues to be stereotyped and stigmatized across many cultures and societies. And stereotypes play a powerful role in shaping how we think about and interact with each other, as well as how individuals within that stereotyped group see themselves. Stereotypes of aging include assumptions and generalizations about how people of a certain age should behave, what they are likely to experience, And usually those assumptions don't really consider individual differences or unique circumstances. Family caregivers often face many of these circumstances that affect changes in intimacy, which will be explored in the next couple of slides. Stereotypes of aging often depict later life as a time of declining health status, loneliness, dependency, or poor physical and mental functioning. It's a common experience for some older adults to feel shame or embarrassment around aging because of some of these narratives, while family caregivers might not feel totally comfortable addressing intimate or sexual needs in the person that they are taking care of. We want to try to challenge these stereotypes and recognize that aging can also be positive, or even see it as a neutral thing, since the aging process is inevitable no matter what we do. And a good example of this is on the comic on screen. So when we challenge social norms and stereotypes, we can better accept and also celebrate that aging is inevitable. We can't control getting older, and we shouldn't feel apprehensive about meeting necessary needs like intimacy as we and our loved ones get older. So, what is intimacy? The desire to continue sharing life in fulfilling, intimate ways is relevant at any age. Lack of the ability to intimately express ourselves is often associated with depression or despondency. Many older adults are as active today as they were in their younger years. So, this could include intimate relationships, it might include sex, it doesn't have to. A healthy, intimate relationship can positively affect all aspects of life, including physical health and self esteem. Intimacy refers to a distinctly close level of communication between two people. This could be reflected in confiding in someone, candidly talking to someone, meaningful shared silences, or mutually enjoyed activities like cooking or painting. And of course, this could also include sexual interaction. But intimacy is not a synonym for sex, but instead, it might suggest the idea that sex is potentially a unique type of communication between two people. Another way to describe intimacy might be a warm friendship. So it's definitely a unique and close bond between two people. And we can even apply intimacy to the relationship with ourselves, right? The last point on this slide is a quote that I think is a good thing to keep in mind as a family caregiver who might be getting older themselves, or if you're taking care of someone who is getting older. So it says here, our need for intimacy doesn't fade as we age. So in other words, if something was important to us before, it's likely it will still be a priority to us as we get older. So we will be going over some physical and social challenges that impact sex for older adults in a couple of slides. So intimacy versus sex. There's often a stigma or taboo around talking about older adults engaging in sexual activity. Meanwhile, others might embrace their sexuality and be more open to discussing their situation with family caregivers. While talking about your aging parent dating again or having sexual relations while having certain health conditions might be uncomfortable or awkward, communicating about the subject might help both caregiver and care receiver feel more at ease, and it helps to also develop a closer relationship. Some tips around talking about sex as a family caregiver to an older adult are to maybe bring up the topic gently, ask how the relationship is going by using terms such as sleeping over, especially if words like sex create an environment that causes you or the person that you're taking care of to feel awkward or shy away from the conversation. One of the most difficult areas for caregivers can be knowing when a sexual relationship is or isn't appropriate. So, as a caregiver, it's important to know that the relationship is consensual for both parties. Sometimes this could be simple, like asking questions or just working with other members of your caregiving team to help supervise and watch for certain cues that the relationship is desired by both people involved. Um, in dementia caregiving, this can be a little bit harder to determine, and caregivers should be aware that consent may be momentary, but that doesn't mean that it's not wanted or not desired. Caregivers can play a part in these kinds of relationships by providing transportation or even facilitating sleepovers or dates that allow those involved to be near each other while centering safety. So privacy is obviously important in these situations, but sometimes having a caregiver nearby or even access to a medical call device can help ensure that assistance or help is nearby, just in case there's need for medical information or just some general help. Okay. So here we're going to talk about sexual health for older adults. Sexuality and intimacy are important parts of life for many older adults. Research shows that having sex in older age is associated with better heart health and improved quality of life. However, age does not protect us from sexually transmitted infections. Older people who are sexually active may be at risk for infections like syphilis, gonorrhea, chlamydia. These are all curable with antibiotics. There's also the risk of herpes, Hep B, trich. Hopefully, a doctor is available to talk about these things, but sometimes older adults may lack knowledge around STIs and they may not feel comfortable discussing sexual health with their doctors. So this leads many to engage in unsafe sexual practices. Interventions aimed at older adults are clearly needed, but sexual health is often not addressed as a priority like some other like standard medical care is. Prevalence in sexually transmitted infections in adults age 65 and older have more than doubled recently. And these numbers show us that older adults are still very much sexually active, and this solidifies that the desire for intimacy doesn't decrease as we age. The number of older people with HIV and AIDS is also growing. HIV is often misdiagnosed in older adults due to overlapping symptoms. There's also the issue of testing isn't often done. STI screenings are also not as prevalent in older adults due to stigma. Condom usage also decreases as we age due to factors like getting married or sexual education just looks different now than it did before when older adults were younger. So we should encourage our loved ones to speak with a doctor, a trusted doctor, to start a dialogue about STIs. We might assume doctors will address important aspects of our loved ones' well-being, though some doctors might avoid the topic of sexual health. Maybe they feel uncomfortable discussing it based on conversations around sex and older adults not being as prevalent. They might also just make the mistake that older adults are not sexually active anymore. So problems like this make it more important for family caregivers to keep loved ones informed about sexually transmitted infections, while hopefully more comprehensive education around sexual health for older adults is being addressed. Just because currently it's obviously more catered to younger adults. So how does aging affect intimacy and sex? Aging does not have to negatively affect intimacy or sex, but physical changes can occur that may need to be accommodated. Adult children who are caregiving for their aging parents may want to consider certain physical changes that might curb activities that might be They might not be sexual, but they are intimate, like walking together or exercising. Spouses might consider how their or their partner's maybe mobile decline or cognition might affect their sex life, or even every day-to-day intimate moments. Based on research, spousal caregivers are said to be more prone to depression than older children who are caregivers, just because they often not only lose physical intimacy, but potentially a deeper connection if those partners are no longer emotionally or cognitively capable. So, in a few slides, we will go over how to love in different ways to address this changed intimacy need. There are many different ways to have sex and be intimate, alone or with a partner. Some people may choose to engage in sexual activity. Some people may not, and that's also normal. So, here we'll explore some more common issues that older adults face that affect sexual intimacy. And again, always please confide with a doctor about any medications, change in a dosage, or if you're wondering how or when sex is safe to have, just because everybody's bodies and capacities are different. So we see there's varying physical changes that might happen in the body. Some are normal, like maybe there's a limited mobility change. There might be vaginal dryness that some people experience, erectile dysfunction. These are all normal changes that happen as we get older. I just want to reiterate that just because our bodies are changing, our desire or need for intimacy does not decrease with age. So, again, if this was something relevant to you before, it will likely still be important in later life. There's also issues from chronic illness. For example, maybe arthritis. Joint pain can make sexual contact uncomfortable. Sometimes rest, a warm bath, or even changing a position might be helpful. Diabetes is an illness that might cause erectile dysfunction in some men. There is treatment available. Women with diabetes are more likely to have vaginal yeast infections. So that irritation might make sex uncomfortable or undesirable. Again, yeast infections can be treated, and it's just best to talk to a doctor about any follow-up treatment. Heart disease is another condition that many people experience that affects sex. Even though sex is generally safe, you always want to follow your doctor's advice. If you have chest pain, shortness of breath, even while resting, you do want to consult with your doctor for maybe a change in your treatment plan. Another common issue might be incontinence. So loss of bladder control becomes more common as people grow older. Pressure might be on the belly during sex, and that could cause, loss of urine. So this could be helped by changing positions, or you can use the restroom before and after having sex. The good news is that incontinence can usually be treated. I want to touch on depression. This sometimes impacts physical intimacy. If you're no longer lack of interest in activities you used to enjoy, that might include sex, this can be a symptom of depression. And sometimes it's hard to know if you're depressed. So again, please talk to a doctor as depression can be treated. And medications are another point on the slide. Some medications can cause sexual problems like erectile dysfunction. It might reduce libido for both men and women. It might cause vaginal dryness or difficulty getting aroused. Again, medications can be changed, and this is something that you will want to talk to a doctor about. And lastly, alcohol might be a factor. Too much alcohol can cause erection problems in men, and it might delay orgasm for both men and women. And sexual behavior changes related to dementia we will talk about that in the next slide. But again, please use this information as general knowledge to better understand how to meet your loved one's needs as a family caregiver, and always refer to a doctor for next steps if you have questions around safety or medications. So capacity is a spectrum. There isn't one standard answer around how to address dementia, caregiving, and sex. Also, it might depend on the stage of the disease and different diagnoses. Some people who have dementia show increased interest in sex and physical closeness, but they might not be able to judge what is appropriate and what isn't appropriate. So those who have severe dementia might not recognize their spouse or partner, but they might still desire sexual contact, and maybe sometimes they'll seek it with someone else. So it could be confusing to know how to handle this situation. And here too, talking with a doctor or a social worker who is knowledgeable around dementia caregiving might be helpful. Changes in sexual expression may lead to behaviors such as publicly undressing or other sexually suggestive behavior. We do want to keep in mind, while it might seem sexual, it might mean something else for them. So this could include the time of day. Maybe someone who has dementia who is displaying this behavior might want to be going to sleep. Maybe their clothing is too tight. Maybe the weather is bothering them, or the room is too warm. Maybe they need to use the restroom. So behaviors like this may not be intentionally sexual, but again, it can be difficult to determine or handle, especially in dementia caregiving. So know that there's no single approach that will work for every couple or for every caregiving situation. A certain behavior might mean something else, and it can definitely be helpful to understand what they need so we can meet their intimate need. Our relationships with someone who has dementia can shift, and this might call for showing affection in new ways. Safety is key here, especially when someone who has dementia may refuse help with certain intimate tasks like bathing, using the bathroom, or getting dressed. So again, I always want to reiterate, talk to a doctor or a neurologist that can help navigate some of these behaviors. And the Alzheimer's Association is always a great resource. And we see here on the next slide, here are some tips that the Alzheimer's Association does provide to respond to sexual behavior changes. You don't overreact or express shock. Like we talked about earlier, you might want to redirect the person to another activity. Try not to be upset or argumentative, as this might escalate some behaviors. And always try to be sensitive and reassuring, right? So here are some social factors that might impact intimacy for older adults. Isolation is a big one. And sometimes certain cultural factors play a role in feeling more loneliness or more isolation for older adults. For example, affection and physical touch are not usually prevalent in traditional Asian American households. Without that affection and physical touch, it might make someone, be more feel lonely. They might feel uncomfortable asking for certain things just because this isn't a norm in that culture, anyways. Older adults may also feel like they're a burden to their family members, so they will isolate themselves in an effort not to bother anyone. So burden is a huge factor. There may also be abuse going on that impacts an older adult's ability to have healthy intimacy with others. Like we briefly talked about before in the sexual health slide, There is sometimes a reluctance to discuss effects of aging or sexual health with other family members or with doctors. This could be because of stigma. They might feel shameful or embarrassed. Um, Privacy is a big one, and this is often a common concern in nursing homes. Studies have shown that older residents are denied consensual sex because of concerns regarding safety, ageism, and potential repercussions from family members. So, as a caregiver, you may be called upon to help navigate the situation with the facility and possibly other residents' family members. Um, all people are sexual, with certain exceptions, and regardless of personal opinion, family caregivers should be aware that older adults are still likely to experience sexual desires. So, if a person you are caring for is not in a relationship, if they're not married, they don't have a long term partner, that doesn't mean that sexual feelings are still not present. Sometimes self stimulation is common. Um, And if this happens, one should be given privacy to allow for the expression of this um, and to just express their sexuality. While encountering someone you care for in a sexual situation might be embarrassing or uncomfortable, especially for adult children caring for a parent, it's helpful to remember that sexual drive is a very natural impulse. And this is relevant from puberty through to the end of life. By helping older adults have an open dialogue about their sexual health, on top of their standard medical health needs, family caregivers can help their loved ones reap the positive benefits of a healthy sexual relationship. There's also unique social factors for the LGBTQ community. And that could be existing social stigma, homophobia, or transphobia. So these stigmas create more of a barrier in meeting needs, and older adults who are gay, lesbian, bisexual, or transgender have higher rates of depression, alcohol or drug abuse, heart disease, obesity, and risk for HIV. It's important to talk to a trusted doctor about sexual health needs to center safety and advocacy for this population. And it's especially important to find support in a local community organization. Though it's also important to note that LGBT population may be more fearful in trusting a doctor due to discrimination within the healthcare system or not be accepted by other people or home healthcare workers. It's definitely a unique set of challenges to be a caregiver in this community. So, in other words, finding trusted support is vital in having those intimacy needs met for this group. And lastly, technology. Many older adults have turned to the internet or online apps to connect with others. This could be for dating purposes or maybe even just to connect on a platonic level. While technology has been helpful for some to find new connections or continue connecting with family or friends, especially during this pandemic, it can also be a barrier depending on their understanding of how to use a device and their ability to safely use it. So, why is intimacy important? For family caregivers, it's common for relationships to become strained with the person they are taking care of, as well as with other people outside of their caregiving journeys due to changed roles, increased stress, or isolation. So, building and maintaining intimacy with a loved one is important as it builds closeness and emotional connectivity. And these are some keywords that some of you brought up in the chat earlier. Um, and new relationships, whether they are sexual or not, are important to combat depression and loneliness, as family caregivers do experience higher depression rates. Caregivers may feel less stress when better understanding their loved one's needs, on top of establishing trust and a relationship outside of their regular caregiving roles. So, outside of driving to doctor's appointments, taking care of finances, shopping, oftentimes caregiving diminishes the relationship previously had with your loved one before this caregiving role started. So, it's important to be open about intimacy needs to establish that trust and comfortability, even as roles change. So, I think this comic is a really great example of what it means to find a different way of loving. Shifts and lulls sometimes happen naturally as couples get older, and relationships obviously change between family caregivers and the person they're taking care of that are not on a sexual or romantic level. Um, Basically, stresses get sped up due to caregiving. But despite losing physical or other intimacy due to changes like physical or cognitive changes, like we talked about before, family caregivers might stay in relationships because of a long time history, having a genuine fondness for their partner, or maybe sometimes they feel a moral obligation to be there. So it's a different type of connection, and it may not meet needs in the same ways as before, but this new relationship, it can still be satisfying and build that emotional connectivity. It's so important to maintain regular contact with friends or other caregivers, like in a support group. In instances where your loved one might fall ill, they might be able to do little to meet their caregiver's emotional or intellectual needs. So, good friends become that much more valuable in meeting some of those intimate emotional needs. So again, it doesn't have to be sexual in any way. For example, if we're taking care of our aging parent, maybe we can take them out for a movie. Thinking of post-COVID times, or get takeout if that's not something that you usually do. Cook meals together versus for the other person, because I know meal prep is big for family caregiving. Um, there's many options to build that intimacy, right? So here we see healthy relationships. A healthy relationship is key in developing and maintaining intimacy. So a healthy relationship is not a power struggle. We don't all have to feel the same way about everything. A healthy relationship is not confined to a sexual relationship, which must end in orgasm, but it celebrates the sharing and exploring aspect. In an intimate or close relationship, we feel free to be ourselves, to care for another person, and to openly ask for what we need. These are the relationships that contribute to our happiness, or if they go wrong or fail, sometimes we'll feel less connected or dissatisfied. So, like I mentioned earlier, intimacy also has been thought of as a companionship, or how I like to look at it, a warm friendship. Emotional connectedness and bonding is definitely good for us as humans. Family caregivers experience a changed role that often places a lot of everyday decision making on their shoulders, which might be especially challenging around intimacy. We want to make sure our loved ones who are getting older have agency and independence, especially since there is that stigma around intimacy. So we do want to allow people to make their own decisions, and establishing that trust does make these conversations a little bit easier, and more natural to have. So I do want to leave everyone with the question of how can we nurture our caregiving relationships, but still allow our loved ones to have agency and choice, despite the intimacy challenges faced by older adults that we discussed earlier in this presentation. So, can we find ways to meet those needs while centering safety and balance within our relationships? Of course, trial and error is to be expected. Some things don't work for everyone, but hopefully, this presentation helped illuminate some ideas around how to have some of these conversations. I did share my email in case you'd like to reach out for anything else. And then I will share our website as well in case you'd like to utilize anything on there. So caregiver.org. Thank you, everyone. I'll stay on for a couple more minutes for questions, but hopefully you guys enjoyed the presentation. My email is there if you'd like to offer any feedback personally. I always welcome that. Hopefully you guys enjoy the rest of your day and the weekend.